So now patient is presenting to you. He's totally asymptomatic. His bilirubin levels are raised. Along with that, his ALP levels are raised. So what do you do? How do you proceed? You just simply perform right upper quadrant ultrasound test, and you see, is there any evidence of biliary ductal dilatation on the ultrasound? I mean, you see that thing on the ultrasound. If yes, then it is most likely extrahepatic, that you can see it, right? It's not within the liver. The thing within the liver you cannot see. Okay, so if you see that on ultrasound, it's extrahepatic cholestasis likely. And so is the cause identified? If yes, then treat the underlying cause. But if no, then perform advanced imaging studies. Like, what are that? That was simple ultrasound before, right? And now you will perform advanced ultrasound imaging, and that include MRCP, that is magnetic resonance cholangiopancreatography, or endoscopic ultrasound, right? If by doing MRCP or EUS the cause has been identified, then treat the cause. But if no, then further referral to hepatology for additional evaluation. Simple. That is for consideration of liver biopsy. Now, if on ultrasound you cannot see a simple right upper quadrant ultrasound, you cannot see any other thing, anything like biliary ductal dilatation, you cannot see that. So it's intrahepatic cholestasis likely, and that is most commonly because of a drug medications. So you discontinue the culprit medication, and it could be because of primary biliary cholangitis. So you do for go for anti-mitochondrial antibody levels, and if that is not the case, then additional testing may also be needed for the for evaluating the cause. And now an important thing, that the extent of testing should be informed by the patient's history and risk factors. Now, if you see any of the patient having risk factors for hepatitis B, C, then you go for serologies for viral etiologies like hepatitis B, C, AE, cytomegalovirus, and EBV, and also exclusion of intrahepatic cholestasis of pregnancy by doing serum pregnancy test and serum bile acids, and also perform MRCP for primary sclerosing cholangitis. Now, the patients with unexplained cholestasis, like despite doing all of these tests, then you simply have to refer the patient to hepatology for consideration of liver biopsy to rule out infiltrative diseases, right? And the ERCP is something which is an option if needed to facilitate management to remove a CBD stone as well, like it is therapeutic as well. So that's all.